LinkedIn is pretty great at a lot of things, like helping you tap into the latest trends and insights in your field. We cannot stop your coworker from tapping her pencil. LinkedIn can help you find new jobs that align with your career goals. We cannot help you find the source of that weird smell in the office fridge. Ew. And while we can't stop your coworkers from bringing their hobbies into the office, LinkedIn can help you bring your career to the next level. LinkedIn is the network that works for you.
On December 12th, Disney Plus invites you to go behind the scenes with Taylor Swift in an exclusive 6-episode docuseries.
I wanted to give something to the fans that they didn't expect.
The only thing left is to close the book.
The end of an era. And don't miss Taylor Swift, The Eras Tour, the final show, featuring for the first time the Tortured Poets Department. Streaming December 12th, only on Disney Plus.
Welcome to The Hypnotist, the show that gives you inside access to cutting-edge hypnosis with real clients facing genuine issues. Brought to you by the hypnotherapist demanded by celebrities, CEOs, and even royalty, Adam Cox. These recordings took place live from Adam's clinic in London's world-famous Harley Street. So, get yourself comfortable and enjoy today's episode of The Hypnotist.
Hi, it's Adam here. Now, this is quite a specialist hypnosis session because it was created for a client that was about to have a mastectomy, so surgery for the removal of breasts because they had a tumor, breast cancer, and they were going to go through a removal of breast, the mastectomy, and then plastic surgery to have the new breasts to maintain and enhance the shape. Obviously, they were apprehensive about the surgery. So this hypnosis session was designed to do two key things. One, help them feel relaxed and calm and empowered by what was happening rather than daunted. And then secondly, to give it meanings of fast healing and positivity that everything was going to go well. Now, this was for a very specific case. It's unlikely if you're listening to this that you're just about to go through this very specific surgery in the same way that the client was, but there are lots and lots of empowering suggestions throughout this. So if you have any form of surgery on the horizon, you might find this useful. Or if you have had surgery and you want to hear healing messages, you also might find this session quite useful. Now, because it was so bespoke, ignore any suggestion that is not relevant, hone into the ones that are. And if you like the idea of working with me directly to have a bespoke session, I would encourage you to look for the links in the description, and there you'll find out how to explore working with me one-to-one rather than listening to the recordings that were made for other people. So if that's of interest, check that out. For now, though, I want you to find a quiet, relaxed place, the kind of place where you're not going to be distracted or disturbed. Relax and enjoy the session. Take a deep breath in, and as you breathe in that resourceful feeling of calm and relaxation. And as you exhale, give permission to release any tension, any anxieties, any worries. Just allow the possibility that anything that's getting in the way of relaxation or optimism isn't necessary here. Breathing in resourceful relaxation and exhaling tension. And just scan your body from the top of your head down to the tips of your toes, like a scan, looking for any clues of muscles or tendons tensing when they don't need to, tightness in the jaw, around the neck or the shoulders. Sometimes tension is hiding in the tiny muscles of the forehead, or even in a finger or a toe. So as you breathe in that resourceful feeling of relaxation, let go of any ideas of holding on to tension. Start to imagine what your body would feel like if your limbs were like the limbs of a puppet with no strings, just loose and floppy and relaxed. That's it. And I wonder if you can notice that the deeper you breathe, the more relaxed you feel. And the more relaxed you feel, the deeper you breathe. Each breath takes you deeper and deeper relaxed. In fact, you might allow yourself to elongate the breath even more. Breathing in, slow and long, and as you exhale, just allow that exhale to keep on breathing out. And as your breaths get longer, you are activating the part of your nervous system that can rest, digest, and relax. And maybe your heart rate slows down slightly. Your muscles let go of that tension. Maybe certain nerves activate and others become less sensitive. I want you to think of a switch or a dial inside that starts to reduce those hormones like cortisol or adrenaline and increase those neurotransmitters that know how to relax. Just allow your body to move gently toward a state where healing mechanisms work optimally. That's it. You already understand physiology, and you already know how expectation and relaxation influence the chemistry of the body. This is not about wishful thinking or believing something untrue. This is about allowing the body to enter the most supportive state possible. So as your breathing settles into a slow and steady rhythm, you can allow your mind to drift to a memory that represents love, safety, and connection. I want you to imagine looking at photos of your wedding day. See who was there. Maybe there was a celebration. Friends and family all gathered together. And you know the year. You know the date. And I want you to find those photos of you smiling Not just looking happy, but being happy. And I want you to imagine bringing those photos to life, hearing the music, that ambient sound of conversation and laughter. And then I want you to imagine stepping into the photo, not as you were, but as you are now. I want you to imagine going back to that moment. Notice the people who matter most. And I want you to imagine that you even meet yourself back then. Maybe you see your mother, your grandmother, your brother, your family, friends, the people who love you, that want the best for you. This isn't just a memory. It's a memory fusing with your imagination. And I want you to invite your children at their current ages back to that day, that moment. And I want you to dial up the feeling of love, connection, harmony. Everyone who means the most to you is together in one place, past and present. And maybe you even choose to bring in people that aren't even born yet. Bring them all there, and you can see their faces. Feel the warmth of the room. And then just imagine having conversations. I want you to imagine that you congratulate that younger version of you on your marriage, but they're wishing you well for your operation, for your surgery. And I want you to imagine hearing the words coming from the mouths of the faces of the people that you love and love you. They're sending you encouragement, confidence, calm certainty. Hear them saying, "The surgery will go well. You'll heal quickly." Hear the words that you will have a long, healthy, happy life ahead. There's no sadness, no trepidation, just positivity, love, smiles, confidence, reassurance. And I want you to connect with those feelings of support and love. I want you to borrow their confidence and feel it in you, and just allow your body to absorb those messages. And I want you to imagine even the people that aren't alive in the present but were alive then. Feel their presence, their positivity. Almost like the essence of them is still within you, even though physically they can't be. And then I want you to imagine finding a quiet room connected to where you were back then in that memory, with a large screen. And imagine this screen allows you to observe the future as you want it to be. I want you to see yourself arriving at the hospital, See yourself meeting the team, the two different surgeons. See the professionalism, the focus, the skill. I want you to see that the operating theatre is not a place of danger. It's a clean, precision environment. A coordinated group of specialists working together. Plastic surgeon, the surgeon doing the operation, the anaesthetists, and they don't all have to be in this room. They can be wherever you want them to be, but each one highly trained, and each one focused on the same outcome. A good result. And that might mean clear margins, a small tumor removed completely, no lymph node involvement, and careful reconstruction. But let's rewind and just imagine observing things going as you want it to go. Just imagine there you are. Maybe there's close family. And then maybe you observe yourself talking to the anaesthetists and them explaining the process. And then imagine, observe, not experience. See yourself like you're someone else and see the anesthetic is administered. Observe that version of you where your body relaxes, you're breathing steady, like a deep, deep sleep. And while you're resting deeply, I want you to see that your body cooperates perfectly with the procedure. See the surgical team working with precision. Tumor removed fully. Clear margins contained, complete. Lymph nodes unaffected. Healthy tissue preserved. I want you to imagine that things are working as the surgeons intended. Maybe you observe the nerve grafting. I want you to see that it wasn't just possible for the mastectomy, it was also possible for the reconstruction. See not just implants, but those implants, the preferred ones, positioned with care. And you can speed up time. Imagine that the way things have happened makes it easy for blood vessels to reconnect smoothly, for nerves to reconnect with sensations. See balance, stability. And just imagine that you're observing that version of yourself where your immune system and all other systems are supporting this process. Minimal bleeding, efficient clotting, calm inflammation. Like there is an intelligence in your cells that knows what to do. Repairing, restoring, rebuilding. And then imagine seeing that 4 or 5 hours of surgery going well, but then you're taken to a different room, a recovery room. But this is where you'll change perspective. I want you to imagine now that the surgery has finished. Imagine taking a first-person perspective after the surgery, but before you awaken from the anesthetic. Connect with that deep feeling of relaxation. And just imagine feeling that moments before you awaken, your unconscious knows that the procedure has gone well. The tumor has been removed, the reconstruction completed, and your body begins the gentle process of waking. And your awareness returns slowly. And you might feel woozy or disorientated. So before any tangible, clear thoughts arise, I want you to connect to feelings of gratitude for your family. Your husband, imagine his face. Your mother, your children. And you can feel the love you have for them and the love they have for you. Feel that support, that care, that connection. And then maybe you connect to that feeling of gratitude for the medical team and all involved who cared for you. You appreciate the skill, the dedication, the quality of care, the expertise that supported your healing. And then imagine in that disorientated aftermath of the anesthetic, just imagine, just temporarily, what it would feel like if people from the past were in the room with you. You know it can't happen in reality, but just imagine the essence of people who shaped your life. People from your past. People that, if they were alive, would want to know that you're okay. And just connect with that feeling of love you still carry for them. And that love becomes strength. And connect with something wonderful, something powerful. Love changes biochemistry. Love reduces stress. Love supports healing. And just allow that feeling of love to flow through you. And then imagine you're no longer in your body and just see yourself back on that screen in the hours and then the days following surgery, and see that your body is cooperating. Remember how you prepared in many different ways, nutritionally, even body temperature, blood flow, oxygen. And almost imagine you can see warmth flowing gently through the tissues, blood supply nourishing the area. Your imagination can distort time, see cells repairing, see the inflammation remaining calm and controlled. And just imagine that any nutrition you've taken in, proteins, vitamins, minerals, hydration, all used intelligently by the body to support healing. Imagine seeing scar tissue forming neatly, organized collagen, smooth repair, and you rest comfortably. Just imagine, even when you sleep, your body doesn't need to move that much. Your body seems to know to avoid movement, to remain still when necessary, and yet still sleeping deeply. The kind of sleep that is regenerative, restorative, healing sleep. And observe how each day brings small improvements. And then observe over the coming weeks how that healing progresses steadily, that you're giving your body the time it needs, that movement returns gradually, especially around the shoulders, and maybe the physical therapy helps restore strength and mobility, and before long your shoulders can open and your arms can regain that mobility. And it won't be long until you're stretching again in the mornings. Your body is adapting intelligently. Your scars are healing and healing some more and become less visible, becoming smooth, well integrated. I want you to see someone responding well to the surgery, with a body that adapts, protects, and heals. And then let's move forward even further in time. Imagine seeing yourself 2 months after the surgery, looking stronger and doing things that demonstrate that strength and healing. Movement has returned. Your body has adjusted. Imagine seeing yourself looking at yourself in a full-length mirror, happy with the result, and seeing the skill of the reconstruction. You can see how it's balanced, aesthetically pleasing, and healing continues to improve. And you recognize something in that future version of you. 2 months after the surgery, you are still you. Your intelligence, your strength, your femininity. Your identity has never been defined by tissue. Who you really are is not what you've gone through. It's who you are at your core. And I want you to connect with an idea that this surgery helped protect and enhance your future. So instead of going 2 months into the future, I want you to go a decade or 2 decades or even 3 decades into the future and see that future version of you living your life, healthy, active, connected with the people you love. And maybe imagine that future version of you 30 years from now, thinking back to that moment of surgery, not as a inconvenience, a tragedy, or a frustration, or anything other than a turning point that in some way was necessary for you to have that healthy, happy future of vitality and connection. And you think back of how you handled it with courage, intelligence, a deep respect for your human body, with support and help. And you're grateful that your body did what it was designed to do, to adapt, to recover, and to heal. And as you drift, find yourself back in that room, and then leave back to that celebration, but feeling what you would feel like way after the surgery, when the healing has taken place satisfactorily, and how happy everyone is to see that you're doing well. Imagine giving hugs and saying your goodbyes before jumping back through that wedding photo. And imagine lying on a bed, head on a pillow, knowing that your unconscious mind now has a choice. Because very soon I will count from 1 to 10. And if your body is ready to awaken, when I get to 10, your eyes will open and you will feel alert and awake. But if you're listening to this and your body wants to sleep, then me counting from 1 to 10 will just be stepping stones into deep, healing, regenerative, restorative sleep, enabling you to rejuvenate while you sleep. And you don't have to consciously decide, just allow your unconscious to do that for you. As I now count from 1 to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Thank you so much for joining me on today's episode of The Hypnotist. If you've enjoyed this episode or got some value from it, please give it a 5-star rating and review. And maybe you know someone that would also benefit from this particular episode, in which case share the episode with them so they can also get the benefit too. And if you would like to listen to this episode where it's just the hypnosis, so no intro, no outro, no explanation, just the hypnosis and completely ad-free, there will be a link in the description where you can subscribe at a very low cost and only get access to the hypnosis. So if that's of interest, please check that out. Thank you again for being a regular listener of The Hypnotist, and I'll see you again soon for more.